Program of Experience in the Palliative Approach, or PEPA, supports Australia's health workforce to deliver holistic care to people affected by chronic, advanced and life-limiting illness. In Aboriginal and Torres Strait Islander communities, talking about death and dying can be taboo and not openly discussed. PEPA offers the opportunity for Indigenous Australians who are currently working in health to link holistic practices and develop their skill and knowledge in caring for people when they are finishing up. PEPA engages with Aboriginal people and organisations to put together a culturally safe and respectful program so that Indigenous healthcare providers can have positive experiences in caring for people at end of life. Workshops use cultural case studies to encourage open communication and recognise the need for advocacy between families and services. They build on people's experiences by supporting sorry business and acknowledging traditional beliefs. PEPA placements further assist Indigenous healthcare providers to link traditional and contemporary practices. Since 2007, PEPA has provided placements for more than 300 Aboriginal and Torres Strait Islander health workers. PEPA has facilitated over 175 workshops delivered to more than 1,200 Indigenous attendees across metropolitan, rural and remote areas of Australia.
Being an Aboriginal health worker, I go out into the community and help people and their partners with their chronic disease.
I had a couple of patients on TI that were referred to me who had cancer and didn't have much time to live for. So my job was to work with the patient and their relatives and to ensure that they had good quality services.
Sometimes people leave their homes and communities for treatment, but when that treatment is over or stopped, they may wish to return to their home or communities for their end-of-life care. It's helpful for those people to have a health worker who's had exposure to the palliative approach to care and learning how to manage physical symptoms, difficult conversations and other issues that can arise.
I was apprehensive about working in a place where there was death and dying, but when I got there, the doctors and nurses were very helpful. My PEPA placement gave me the confidence to have those difficult conversations with my clients.
Doing PEPA placement reassured me that I was on the right track with my patients and their families. One of the most important things I learned from my placement was to provide services for people who are in need of palliative care, and that's a big plus.
Funding is available as a contribution towards backfill, paid to your employer and towards travel and accommodation costs for regional and remote participants. To register for upcoming free palliative approach workshops in your local area and apply for a free PEPA placement, visit pepaeducation.com.